The 2019 Competition Commission's Health Market Inquiry found that the private health sector is characterized by high and rising costs of healthcare and medical schemes cover. It also found that there is a decline in benefits and significant overutilization of health services. Health Minister Dr. Aaron Motsoaledi says billions of rands have been spent on administrators in this sector. He says this is money that should have been spent on patients. Motsoaledi says in accordance with the inquiry's recommendation, an interim board will be put in place to regulate the space.
We believe we can't set up an independent supply chain regulator for healthcare because the Treasury has told us very clearly that they will never countenance the formation of 3A public entity because those that are there, they are actually de-establishing them.
The Minister of Trade, Industry and Competition, Parks Tau, says there is no structural framework for determining price tariffs in healthcare services. Tau says this has led to unaffordable medical fees charged by practitioners.
Due to the lack of a formal tariff determination framework, consumers are faced with uncertainty on prices, potential balance billing, and tariffs which are not determined through a transparent process. As a result of this gap in tariff determination, patients, medical schemes, and even smaller healthcare providers are often disadvantaged. This has resulted in rising healthcare costs, making essential healthcare services unaffordable for many South Africans.
At the same time, Motsoaledi says South Africa is one of the 2 countries in the world that still pays for healthcare in cash. He says this method is unsustainable and should be done away with.
But the World Health Organization said you are the same. You are outlying me because you are doing what other countries are not doing, meaning relying mostly on cash and private medical aids to pay for health. And they said it's untenable and it's unsustainable. That's why some of us are so intent on NHI. Now, the market inquiry is making the same finding, that paying cash for health is the main driver of volume and cost inflation, and do away with it as much as you can and look for other alternative reimbursement mechanisms.
Minister Tau says following consultations with the Competition Commission and the Department of Health, a draft interim block exemption for tariff determination in the healthcare sector was published. He says this block exemption aims to address the cost of access to healthcare and promoting transparency in the healthcare market. Nothando Makutulela, SABC News, Johannesburg.